You've worked hard, saved diligently, and you've built up that 401k. I think you're probably thinking beach trips, time with your grandkids, and finally enjoying life on your term, but there is a problem that almost nobody talks about, and it's a hidden cost that can drain your retirement faster than inflation or taxes. I'm talking about healthcare. Fidelity estimates that an average 65-year-old couple today is going to spend around $315,000 on healthcare in retirement. That's enough to buy a new car every year for almost a decade, except instead of driving it, you're just paying the bills. And here's what most people get wrong. They assume that Medicare is going to cover it all. Well, it won't, and that misunderstanding is costing retirees their future. Life and the markets rarely cooperate neatly. So imagine this. The year you start required distributions, the market dips 25%. At the same time, you face an unexpected medical bill. According to Vanguard research on sequence of return risk, that double hit could cut your portfolio by 40 to 80%. So why? Because you're forced to sell assets when they're down, locking in losses and shrinking the base of your investments and their ability to recover from those losses. If we add in healthcare withdrawals from the same account, the drain pretty much accelerates. One bad diagnosis plus one bad market year can feel like a financial knockout, and that's why in general your 401k isn't enough. It's powerful to be sure, but it's not designed for unpredictable medical costs, and it's very inefficient from a tax perspective in that regard. It's kind of like trying to perform delicate surgery with a sledgehammer. So how do we fix this? How do we turn scary stats into something manageable? Well, before we dive into the solutions, do me a favor, hit that subscribe button and ring the bell so you don't miss the tools and strategies that I'm going to walk through today. So let's start with Medicare itself, because this is really where the biggest myths live. Now, according to Medicare.gov, original Medicare includes Part A, which is your hospital insurance that covers your inpatient hospital care, and Part B, which is your medical insurance covering doctor's visits, tests, preventative services, and so forth. Sounds comprehensive, but here's the reality. You pay for the services as you get them. You must be lawfully present in the U.S. for coverage, and the coverage depends on three factors: federal and state law, national coverage decisions, and local determinations that are made by claims processors. Also, the coverage is limited. Not everything is covered. So you might have some services that are covered in one state, but not another, depending on what's deemed medically necessary. And here's what's not covered by original Medicare: long-term care, dentures, hearing aids, most vision care, routine physical exams. Even for covered services, you're often left with deductibles and co-insurance for some amount. For example, Part B covers 80% of their approved charges. You're responsible for the other 20%. And there's no out-of-pocket maximum. So when people say Medicare covers everything, that's simply not true. And if you plan your retirement under that assumption, you're kind of building on sand rather than a solid foundation. So, step one, I want you to build a dedicated healthcare bucket. This isn't about money, it's about having the right money in the right place, on a separate conservative account earmarked just for medical costs. Aim for 3 to 5 years of out-of-pocket expenses, premiums, co-pays, dental, vision, hearing. Keep it in a high-yield savings or short-term bond funds where it's kind of liquid, stable, with a good, consistent return. And if you're still working, you can obviously max out things like health savings accounts. HSAs really offer kind of a triple advantage in the sense that your contributions are deductible, the growth is tax-free, and withdrawals, as long as they're for qualified medical expenses, are tax-free. The funds roll over year to year, unlike FSAs, and can even be invested in low-cost index funds. After 65, you can withdraw for non-medical expenses, and it's simply taxed as income. And that flexibility makes the HSA one of the most powerful and overlooked retirement tools for healthcare. So if you're still working, still contributing in a corporate plan, definitely something to think about. Prescription costs are one of the biggest money leaks in retirement, and here's what most people miss. Part D plans change every year. Formularies, premiums, preferred pharmacies, all that can shift. And that's why every fall between October the 15th and December the 7th, you need to do some shopping, and you need to shop as if it's Black Friday, right? You want to try to find the best deal, best coverage. So use Medicare's official plan finder, or if you've got a trusted source that kind of specializes in this area, definitely something you want to check out. And enter your actual prescriptions and pharmacies, and it'll show you a projected cost for every plan in your area. I've seen retirees save over $1,200 a year just by switching a plan or a pharmacy, and that's a cruise or a roof repair in many respects, all from just doing 30, 45 minutes worth of research. To retire early? Remember, Medicare eligibility usually starts at 65. Retiring at 60 can leave a 5-year health care gap. And here's what that looks like. If you separate employment, COBRA may extend your employer plan up to 18 months, but it's at full cost, many times much more than what you may have been paying through your employer. And after that, it's the ACA marketplace. For a couple in their early 60s, premiums here can exceed $20,000 a year without subsidies. Be careful with the subsidies as well, because there can be traps there. For example, if you have one large IRA withdrawal or a pension payout, that can push your income over the ACA subsidy cliff, and it could cost you thousands in additional premiums. Meaning, if your income comes in more than what you've told the platform, they're going to basically make you pay a calculation of those premiums back based on the subsidies that you received to originally offset your premium costs. So if you're planning on early retirement, you must budget for the gap and structure income carefully to avoid surprising penalties like that. The danger isn't just that healthcare is expensive, it's that too many retirees plan for myths. So for example, the myth that Medicare covers everything, or that costs go down with age, or your 401k alone can handle it. Here's the truth. You need to build a healthcare bucket, treat it separately. You need to shop a drug plan like a pro, and you need to plan early for Medicare coverage, meaning supplemental coverage, that gap between what Medicare covers and what it doesn't. Supplementals can obviously offset that. A lot of people I know prefer Medicare Advantage plans. They tend to be a little more inexpensive, but at the same time, you're limited. They're typically an HMO type plan. So do these three things, and that intimidating $315,000 number becomes a line item and not a retirement ending shock. Your future self and your portfolio will thank you. So be sure to check out the Medicare.gov website link in the description to find out if what you need is covered. It's better to plan than to fail to plan. This is Chris Wootton with Wootton Financial Group, wishing you a clear direction for retirement. And don't forget to check out our website at retire-clear.com. That's retire-clear.com.